All right, today we're going to break down Dr. Josh Axe's natural approach to dealing with restless leg syndrome. If you're one of the many people who's been kept up at night by this, you're definitely going to want to hear about the strategies he lays out. So let's just dive right in.
You know that feeling, right? That creepy, crawly, gotta move 'em, can't get comfortable feeling deep in your legs, especially at night? It is so maddening, and it can absolutely wreck your sleep. So let's explore one perspective on how you might finally get some relief.
So get this, the source material kicks off with a really bold claim that these natural treatments could work in 24 hours or less. Now, that is a huge promise, so let's unpack the specific strategies he talks about to see how he backs that up.
Okay, so first things first, we're looking at a nutritional approach. The central idea here is that certain deficiencies could be a major trigger for RLS. Let's dig into the key nutrients he points to.
Now, according to the source, the kind of nutrient you take really matters. It's all about making sure your nervous system and your muscles get the right kind of fuel to work properly. And a perfect example of this is his advice on vitamin B9, which we're about to see. So here are the three big ones. First up, you've got magnesium, which is all about helping those muscles relax. Then there's folate, that's B9, which is there to support your nervous and muscular tissue. And third, potassium, which the source suggests helps reduce fluid retention. And think beyond just bananas. We're talking about great sources like avocados and spinach.
But you know, nutrition is just one piece of this puzzle. The source argues that sometimes the problem isn't about what you're putting into your body, but instead, it's about how your body is physically aligned.
And this right here is the heart of that structural idea. The thinking is that RLS can actually come from compressed nerves, maybe in your lower back, your SI joints, or even deep in your glute muscles. Basically, some kind of physical pinch or tightness in that whole area could be firing off those frustrating signals all the way down your legs.
So, if it's a structural issue, what do you do about it? Well, the source proposes this two-step approach. Step 1 is getting professional care, like seeing a chiropractor for adjustments. And step 2 is all about self-care. Things like regular exercise, followed by some really dedicated stretching for your hamstrings, hips, and glutes to keep everything loose and aligned.
Okay, so we've hit nutrition and we've hit physical structure. The third and final piece of this strategy is all about something that's maybe a little less tangible, but according to the source, is just as crucial: your stress levels and your overall state of mind.
And the main tool that gets recommended here is chamomile. It's suggested for a whole list of things that are super relevant to RLS, everything from reducing muscle spasms to just straight up improving your sleep. The source suggests you can use it as an essential oil, or, probably the easiest way, just have a nice cup of chamomile tea before you go to bed.
And to back that up, the source also throws in a few other simple tips for just winding down. The whole idea is to actively shift your body out of that fight or flight stress mode before you even try to sleep. Simple things, like reading a book or journaling, can make a huge difference, creating a nice buffer between a hectic day and a restful night.
So we've gone through all these different elements. How does it all fit together? Let's pull everything back and recap the core action plan that this source material lays out for us. When you really boil it all down, it comes back to these three core strategies. Number 1, fuel your body with those key nutrients. We're talking magnesium, folate, and potassium. Number 2, align your physical structure through a mix of professional care and your own exercise routine. And number 3, calm your mind and body using relaxation techniques to get that stress under control.
And that really brings us to our final thought here, which kind of sums up the entire philosophy of this approach. It makes you wonder, right? What if RLS doesn't have just one single cause? What if relief is actually found at that intersection where what we eat, how we move, and how we feel all come together? It suggests a really interconnected approach for what might just be a very interconnected problem.